Hello everyone, in this video we are going to discuss about emphysema and its types. So first thing first, what is emphysema? It is basically characterized by the permanent enlargement of the air spaces distal to the terminal bronchioles. And this is accompanied by destruction of the alveolar walls, but without the significant fibrosis. Now the patients with the emphysema, they are referred to as the pink puffers. Now, pink means that they require basically a lot of energy for breathing, and puffered because they expire through the pursed lips in order to prevent the collapse. Now, this is the normal alveoli, but in case of the emphysema, as you know that there are large spaces that are caused because of the destruction of the alveolar wall. This causes the increased surface area. Now, what is basically the cause of it? So, let's discuss about the pathogenesis. The smoking causes an increase in inflammation, and this increases the elastasis. Now, let's see what are the role of the elastasis. So, basically, these are the enzymes that cause the destruction of elastic tissue. Now, think of this as the three rubber bands you have around your arms. Now, these can be stretched with difficulty, but they are gonna easily recoil. But if on other hand, you're gonna use only one elastic band, it would be easily stretched, but it's so difficult for it to come back to its original state. That's why these people with the emphysema, as they have loss of elastic tissue, therefore the accessory muscles are working hard, and that is why they require a lot of energy in order to exhale. And that's why they appear pink and flushing. Now, as in these patients, their accessory muscles are working so hard, that is why there are chances of the collapse of the alveoli. That is why they exhale through the pursed lips in order to avoid the alveolar collapse that can take place during the expiration. Now, decreased alpha-1 antitrypsin, which is an anti-elastase, can also predispose a person to emphysema. Now, let's discuss about the types of emphysema. So, basically, it has 4 types. Now, the first type is centri-acinar, which is also known as the centrilobular emphysema. Then we have the pan-acinar, which is also known as the panlobular emphysema. Then another type is the distal emphysema, or which is also known as a paraseptal emphysema. Then we have the irregular emphysema. Now, in case of the centri-acinar, it basically involves the central or the proximal part of the acinus. Now, acinus are basically the structures that are present distal to the terminal bronchioles, like respiratory bronchioles, alveolar ducts, and alveolar sacs. And this type mostly involves the upper lobes, and it's most commonly associated with smoking. Then we have the pan-acinar. And as a pan means whole, so it means that it would uniformly involve the whole acinus. And this type most commonly involves the lower zones, and it is most commonly associated with the alpha-1 antitrypsin deficiency. Okay, then we have the distal emphysema, which basically involves the distal portion of the acinus, mostly adjacent to the pleura, and the characteristic findings are multiple contagious and large air spaces that sometimes form the cyst-like structures that with the progressive enlargement are referred to as bullae. Now, in irregular emphysema, the acinus is irregularly involved, and there also is scarring. Now, although it can be clinically asymptomatic, but this may be the most common form of emphysema. Now, here you can see this is the normal acinus, but in case of the centri-acinar, this involves the central portion of the acinus or the respiratory bronchiole, while the pan-acinar would involve the whole acinus. Alright guys, so that was all about the emphysema. Thanks for watching.